Before we get into this week's episode, I wanted to give a shout out to our newest patrons, Samantha, Shay, and Beth have just joined, the patron party. Thank you guys so much for supporting
Thank
Nurses
you.
Uncorked.
You can go to the link in the description of this podcast if you want to join. We have different levels of patrons, and different ones come with different benefits. So we're going to be sending out some thank you cards, and certain levels we're going to do private Zoom parties. And if even our highest level, you can be a guest on the podcast. We don't have anyone at the highest level. That one's called the Vineyard. It's very fancy, but FYI, it's there. And we're almost, not quite yet. We need a few more to reach 25 patrons. And when we get to 25, we're doing those big 3 giveaways. So stay tuned. You're automatically enrolled if you're already a patron.
I'm Nurse Jessica Seitz, along with Nurse Erica. We're Nurses Uncorked, the podcast that takes nursing facts with nursing comedy and makes a little cocktail out of it. Hi, everybody. Welcome back to Nurses Uncorked. It's Nurse Jessica here and Nurse Erica, and we have a guest. We're not alone this week. We've got another buddy with us. We have Kelsey here, who is the founder of Safe Haven Baby Boxes. You probably have heard of it as a nurse, and if you haven't, you're going to want to stick around and listen. I want to say first, thank you, Monica, for coming on.
Thank you. You're welcome.
Before we get into all the details with Monica about the Safe Haven Baby Boxes, what is our cocktail of the week?
I am making a cocoa lime rum cocktail. I'm super excited about this one. Okay, so there's only 3 ingredients. It's lime juice, the Caribbean coconut rum, and soda water. That's it. Okay, so you need 2 ounces of the Caribbean coconut rum. I've already poured out 1, and wait till you see this. Look what I got yesterday in the mail. It's a Nurses Uncorked shaker, because I didn't have one in a previous episode when I needed one. So Jessica sent me a personalized Nurses Uncorked shaker. This is the first time I'm using it. It's very fancy. I love it.
See, I do love you.
Thank you. I appreciate that. I've also already squeezed in a bunch of lemon juice into here. You need 2 ounces of the coconut rum, 1 ounce of the fresh lime juice, and then you put it in the shaker. All right.
Let's see it. Let's see the shaker. Let's see it.
Shake
oh my
God,
that
line.
Looks good.
Work.
It's a real shaker.
It is. Okay. It says shake until it gets cold. I don't know what makes it cold in there. Oh, it's hard to open. Okay. All right.
Then would be the ice, Erica. It's the ice, honey.
Well, it didn't say to put ice in there, but I did put ice in there. I don't know how shakers work. I have to learn. Anyway.
I think you're supposed to put ice in there. Go ahead.
Pouring it out into my Nurses Uncorked.
Oh my God! Look at that pour! Look at that pour! That is spectacular.
Look at that pour, and then you top it off with soda water. You can also use ginger ale if you want, and you serve it over ice.
It's making me want to pee.
And there we go. I've never had one of these. Let's give it a try.
And?
Oh, that's really good. That's a cocoa lime rum cocktail. The recipe is in the description.
All right. So Monica has an incredible story, which this actually is a really special story that I did not know until I started kind of deep diving a little bit and researching some stuff. But like I said earlier, she's the founder of Safe Haven Baby Boxes. It's a safe and anonymous way for mothers to surrender their infants. It's a 501c3 whose mission is to prevent illegal abandonment of newborns by offering a 24-hour hotline for mothers in crisis and offering a Safe Haven baby box as a last resort option. Monica's passion stems from her own life story, which this is the part I was talking about. This is just surreal. It's crazy. She was born to a 17-year-old rape victim, her mother. And her mother had actually scheduled an abortion, but changed her mind at last minute. So Monica is here with us today because her mother changed her mind. And ultimately, Monica ended up abandoned by her birth mother shortly after birth. So Safe Haven Baby Box's goal is not only to protect newborns, but to walk alongside birth parents, letting them know that they're not alone, that there's options out there. To date, there are over 220 baby boxes in numerous states. Is that right, Monica? Over 220?
We're almost to 250 now.
Oh,
Okay.
wow.
Almost
Wow.
250. Okay, that is amazing. And they have referred over 500 women in crisis pregnancy centers. They have had over or around 151 legal safe haven surrenders, and they have had approximately 51, right, Monica, safe haven baby box surrenders. So we're going to get into the differences of all of that if you're wondering what all that means, and we're gonna talk about it.
Thanks for having me, guys. This is I love your cancer, so this is right up my alley.
We're just a bunch of girls,
We're crazy around
just
here.
chit-chatting.
Just trying to figure things out as we go. Yeah, thank you for being here. Monica, your background is as a firefighter and a medic. How did you end up starting Safe Haven Baby Boxes?
Well, it actually was birthed out of my own story, of being abandoned as an infant. And I've been a firefighter and a medic for many years, so I've always known about the safe haven law, where a parent can walk into any hospital in America, hand their unharmed newborn to a worker there, and turn around and walk away, no questions asked. So I've always known that was available. But I happened to be in Cape Town, South Africa, at a church in Cape Town, and they had a baby safe in the side of the wall. And I mean, I knew about the safe haven law, but I'd never seen anything like this. And I was so intrigued by it. I was like, what is this and what is it used for? And they said, well, women bring their babies here at night when they don't want to show their face. And I'm like, does this really work? And they said that they had saved 7 babies that year. And the interesting thing about this box in Cape Town was the babies that come through their baby safe, people from the church adopt these kids. And so that was just kind of struck me in a way that was pretty profound. But on the flight back from Cape Town, South Africa, on a Delta napkin, 35,000 feet in the air, I handed my version of the baby box on a Delta napkin. And then I started the uphill battle when I got to America, back to America, of implementing a program that had never been done before. And so that's kind of the gist of, why I started Safe Haven Baby Boxes and where the idea came from. But yeah, it's been a journey.
Please tell me you still have that napkin. Do you have that napkin still?
I do.
Oh my
gosh. You should frame it
and
put it on the wall.
So it's so funny. But look at this box.
Oh my gosh.
Yeah.
Wow. That's amazing. You need to frame that and put it on the wall. Honestly. Yeah.
Like a shadow box. Yeah. So will you walk us through a little bit about how the Safe Haven Baby Boxes work? Just a little bit about what a mother does. Yeah, exactly.
So basically we cut a hole in the side of a firehouse. And I say it's not me. It's licensed contractors that do that. And it's like cutting a hole for a window. And the box actually slides in through that space, and the outside of the baby box is on the outside of the building and the inside is on the inside. So it's basically like a door into the firehouse. And so a parent can walk up to the baby box, open the door, place their unharmed newborn inside, shut the door, and literally walk away. The box calls 911 on its own. So if nobody is in this fire station, they're still getting notified. And as a firefighter and a medic, I know the 911 system very well. And so I implemented the box to where no one has to be in the firehouse. Because when people say, oh, there's firefighters there 24 hours a day. No, there's not. If a fire happens, there is no firefighter in this country that is staying behind at all. And so having that option available to call, 911 so that they can get somebody back to the station immediately is one of the things that I knew that had to happen for when they were out on call. And so it's heated on the inside, it's cooled on the inside, and it alerts personnel. And the longest time a baby has ever been in one of our boxes is 4 minutes and 20 seconds. And the average time is 2 minutes.
2 minutes? That's great.
Yeah.
There are some people that are critical of this, but unfortunately, we live in a world where abandoned babies are found in dumpsters too late. We've all heard way too many stories of that. What are some of the criticisms or arguments that you've encountered?
Oh, gosh. How long do we have? So the biggest one that I encounter is, is actually Safe Haven advocates, people in states that are doing the safe haven law, and they want these women to walk into a facility and hand the child to a person. Well, I don't disagree with that. Yeah, I'm like, I want that too, but they're not doing it. So what is your solution? Because they're not.
It's not practical.
Yeah, the law's been around for 25 years. Why do we still see abandoned babies every 3 days in America if your law is working so well? And so I'm just saying this is an option. I'm not telling every woman to place their baby in one of my boxes. What I'm saying is if you can't walk in and you don't want to face anyone, this is an option for you. Just like an adoption plan is an option, parenting is an option. This is just an option for them. And so that's probably the biggest critical thing. The second thing is, electronics fail. That's why we have fail safes. You put all of these fail safes, and you have people that are much smarter than me that came and designed the electronics of the box. I came up with the idea. I came up with, this is what I want it to look like. And I said, okay, make this happen. And so they have 3 fail safes on this box. So if that box fails 3 times, then yes, the box is going to fail. But the chances of that ever happening are very, very, very slim. Plus, there's protocols in place at fire stations to make sure that these boxes are looked at twice a day.
Yeah.
The alarms are set off to make sure the alarms are working. We've tried to make this as safe as possible because we know that this box has to work 100% of the time. And to date, with almost 250 boxes in America, we've never had a box fail yet. And so we're very proud of that. But those are the 2 biggest, the 2 biggest arguments. And then, the other argument is, she's just out there making millions of dollars. She's got a house in Florida and a private plane. And I'm like, where's the house? And the interesting thing about that is my salary is public. You can see how much I get a salary. Of course I do. I wouldn't be able to do this if I didn't. And, but it's public. It's like, just go and pull the 990 and see what I pay everybody. It's like, come on, people.
Of course.
Just open your minds. And so those are probably the biggest arguments that I get. But, in America today, you're going to have criticism. And if you can't carry that well, you shouldn't be carrying any of it. You shouldn't be doing the work you're doing if you can't carry the criticism.
Oh, yeah. We know all about that.
That's a good outlook. Oh, yes. We know all about that. I think whenever you're forward facing in a public way at all, people automatically assume that you're making millions, which is insane to me. Like you said, where is it? Where is it? And then they get critical and holier than thou, it's unfortunate.
What are you talking about, Erica? I'm making millions. You're not? What?
No. I wish.
Yeah, me too. Seriously. So speaking of Florida, I'm a Floridian myself, and this is kind of like a 2-part question, but I remember seeing one video where you had talked about it was some problem you were having with Florida. You were getting very frustrated about something, and I don't remember the specifics of it, but you can get into that in a second. But that just kind of leads into, states have different laws. I think you're up to about 17 states that you've got boxes in, or
yes,
is that correct?
Yes.
So why the huge discrepancy between the states, like as far as drop off, like how old the baby can be, where it's legal versus illegal, touch on that. And then if you can remember the Florida episode I'm talking about, the one that I would love to hear about that.
I have been fighting with Florida for the last 4 years. 4 years to get baby boxes in. You guys have had abandonment after abandonment after abandonment, and they keep saying that it's under control, that the safe haven law is working down in Florida. And I'm sitting here saying, if it's working so good, why did you just have a baby dropped in a dumpster in Tampa? Why did you just have a baby in Mulberry, on in a ditch, basically? I mean, I think in the last year, probably last 12 months, you've probably had 6 to 8 infants found abandoned. And so if the safe haven law is working so well, what about those babies? And so, and Florida passed, and I don't want to get into the abortion debate, but they passed a 6-week abortion ban, and they were so proud, patting themselves on the back. But then in the next breath, they say, well, we don't need baby boxes. It's like, so you want to, take this resource away from parents, which I'm okay with that. But you better make sure that there's resources on the back end if that's what your intentions are.
Right.
And so for pro-lifers, for these pro-life Republicans to ban abortion, but then say, well, we don't need baby boxes. It floors me to think, why are we not giving women more options then if you're forcing them to carry? If you're going to force them to carry, then you better have another option down there. And so that's one of the things. And then, like I was saying, safe haven advocates that are against us that want these women to walk in. Florida's a big part of that. There's an organization down there that's all they do is criticize us for, having these boxes because we can't offer women medical care when they walk in. What the interesting thing about Florida is it doesn't have to be the mother that walks in and hands a baby to one of the workers. It can be anybody. And so if you want to force a woman to walk in and hand the child to a person, you better put that in your law just so you can ask for if she needs medical care. Because right now it doesn't have to be the woman that walks in. And so those are the couple of things that I fight with Florida all the time, trying to get these boxes in. But, we kind of found a loophole in Florida where they're not legal, but they're not illegal. So we're kind of in that gray area. But we're not protecting the mom good enough if she utilizes the boxes. And so the legislator needs to do something in Florida to ensure the safety of these moms, to make sure that they don't get prosecuted for using the box.
That's crazy. Do we have one box? Am I right? Is there one box in Florida, or?
You have two right now. You have
two.
One in Newberry and then one in Ocala. Ocala has had a baby in their box, and you've got a couple more coming.
Oh, good.
Okay. Well, it's a start. We're very interesting down here.
You are.
So,
yeah, you are.
You
are.
I don't even know what to say about that.
Can you speak to the differences in the state laws as far as like the age of the baby? They put limitations on it for surrender. I think there are some states that are as low as, is it 7 days, and then some that go up to 60 days of age. That is vastly different.
Yeah, that is.
There's actually some states that are 72 hours.
Oh my gosh. Wow.
So 72 hours. And then the oldest child in North Dakota can be up to a year. So you literally have a year span on the same. We do not agree with having that, because if I'm teaching, women in school in Indiana that it's 30 days, and then they turn around and they fly to California and go to college, and then they find themselves in this situation, they don't have 30 days in California. They have 72 hours. And so we want to have it the same across the board. But unfortunately, each state law is different, and they just kind of set their own age. And I don't really think they actually take data and put it into the age that they want to allow in their state. Now, the interesting thing is Nebraska, when they first passed the safe haven law in 2008, they didn't put an age limit on it. And so there was one family that brought 6 kids, most of them teenagers, down to the firehouse.
No, they did not.
Oh, yes, they did. And
They're like, listen, straighten up or we're dropping you off under the safe haven law.
I mean, these fire stations, can you imagine what they were doing? But anyway, so they had to do a special session to fix that, because they had all these teenagers being dropped off at the firehouses.
God, so bad. That's terrible.
So they had to have an age limit for sure. But I
can't imagine putting a 1-year-old though in a baby box where like they can sit up and some of them are walking like that.
And they see you leaving, and the abandonment. Yeah.
Oh my gosh.
Yeah, that's terrible.
Have
you ever had an older baby like that surrendered?
Not up to. We've had a 6-month baby surrendered.
Wow.
But we did help this parent surrender in the state of North Dakota, which was legal in their state. So up to 6 months. The oldest child we've ever had in one of our boxes was 90 days. So so not. And you got to keep in mind too that this law was enacted to save the lives of infants that were being born in secret.
Yeah.
And so, when that was passed, that was the whole goal, was to save the lives of these infants. And so the majority of the babies that we get through our baby boxes, actually, a lot of them have the placenta still attached. Cords are cut, but they're not clamped. They're ripped. They're tied with a shoestring. I mean, you name it.
My goodness.
These babies are going to go in a dumpster or a trash can or in a box where they get anonymity. And so, so most of the infants that we get are less than 24 hours old.
Okay. Are there other states besides Florida that are fighting the safe haven baby box?
Oh yeah, yeah.
Oh
How much time
gosh.
do we have? Nebraska, actually. There was a senator, Senator Carol Blood. I don't know if I'm allowed to say that or not, but
It's
she
okay.
actually on the floor, and I did a couple TikToks on it, but she attacked me personally. I mean, she went after me personally. She said that I've had too much collagen and lip filler.
Oh my
And
Good
gosh.
she's
for you, girl. Good
not
for
even
you.
kidding.
If you have,
What
I'm
does
a
that have
huge
to do with
advocate.
anything?
Nothing, but I
Exactly.
say, go, girl, get it.
It's like, but it's like they can't attack me on anything but that. Like, really? So, but she is staunchly against the baby boxes, and she says that we're going backwards by allowing, women to put their baby in a box. Well, yesterday I was at a funeral for two abandoned babies that were getting a headstone. They had been abandoned prior to, but they were finally getting their headstones. And the Marion County Coroner's Office was there, and they're the ones who handled these babies that were dumped, literally just dumped like trash. And she got up there, and the first thing she said was, when I first heard about baby boxes, I thought, we're putting babies in boxes. She says, but then I thought, we're putting babies in boxes in the ground if they're not using the boxes we're putting in. And that just really stood out to me. Like, that's so true. Because if they're going to be put in a box and live, that's great. Otherwise, they're going to go in a box in the ground and not. Just really just touched me. So,
Absolutely.
yeah.
So I think you touched on this a little bit, or we talked about it, but for people that don't understand, can you explain the difference between like the drawer versus the hatch or box? Like what are the two differences there?
So every country actually has some type of baby box. Well, almost every country. There's a few that still do not. But there's baby hatches in Germany. There's a door of hope in South Africa. There's baby drawers in Banner Hospital down in Arizona. There is cradles up in Canada. So, and there's in Switzerland, they're called windows. So
Okay.
there's so many different names for them. But really that's all it is just a name that's different. The concept is all the same. It allows a parent anonymity. And that's truly what they've been asking for many years. I mean, why are we finding babies at the doors of fire stations? Why are we finding babies at the doors of, hospitals? Those are safe haven locations. So these women are going there to save the life of their child, but unfortunately, they're not placing these babies in the arms of people. And they're just laying these babies at the ground, and some of them are dying. And so, so having these boxes in the world, honestly, is saving lives. There's a guy in Korea. His name is Pastor Lee. There was a movie called The Dropbox that came out a few years ago. He put a box in his house. Not even kidding. And it's on YouTube. You can watch it. But it's called The Dropbox. But he put a box in his house because he was so tired of seeing the stories of these abandoned babies. He's had over 2,000 babies come through this box in his house.
Oh my
wow.
gosh.
Where is that?
There was Seoul, South Korea.
Oh my gosh.
His name is Pastor Lee, and he's adopted 33 of them.
Oh my gosh. God bless
Yes.
him. That
Wow.
is what I need to watch that.
Yeah.
It's
What's it called again?
The Dropbox?
It's on
Okay.
YouTube.
Okay.
We'll
Yeah.
put
I'll
a
have to
link
look
in
at
the
that.
description to that too, if anybody wants to check that out, because I definitely want to watch it. That's a
Yeah.
lot of babies.
It
That
is a
is
lot.
lot.
He averages 25 to 30 a month.
Oh my God. That's like just a full-time job in and of itself. Wow.
He's probably woken up almost daily with
And he
Wow.
prays. He prays over each of them. It's
Oh,
just beautiful. It's really just
Yeah.
an amazing story that he has.
Well, every state has safe haven laws, but it's intimidating. We kind of touched on this, right? You as a new mom, a young mom, to walk into, say, a hospital where there's hundreds of people around and have your, full name, identifying everything, and hand over your baby, right? That's obviously a deterrent. So can you tell us how safe haven baby boxes really protect the mom's, anonymity? Are there like cameras outside drop-offs? How does that work?
So every location that does the baby box program signs a contract. And the contract says that they will not have any cameras on the baby box. If they
Okay.
don't sign it, we will not sign with them. We will not do the program at their location. That is a dead hard stop for us because these women want anonymity. If they didn't care
Right.
about anonymity, they would walk in. And
Right.
so that is one of the things that we will not budge on. And the worst thing that we could do is see a mom placing her baby in the box on the 5 o'clock news.
Right.
Because
Exactly.
Yeah. Then
some
no one's
movie,
going to do it after that.
yeah, it's going to completely take away the credibility of the program. And so each location does not have cameras on the box. Now, I know that there's cameras on the sidewalk, probably at the front of the building or whatever. I can't get away from every camera. But what I can get away from is the camera on the box. Another thing that we train on, and on our TikTok channel, we have almost 1 million followers on our TikTok channel. I do training and I put it on TikTok. And we train these guys, these fire stations, to not ask questions because, they say, oh, you can walk in, hand your child to a person, no questions asked. That's wrong. That's not happening. I mean, that's what we want to happen, but that's not what is happening. And so we don't want these mothers to feel pressured into giving their name. And we do understand that giving your baby to a person is safer than putting a baby in a box. So we want them to walk in if they can. And so we want them to feel comfortable. So we're like, don't ask questions. There's only one question that you really need to ask a mom that walks in, and that is, do you need medical care? Is there anything I can do for you? That's what you ask her. Don't ask her why she's doing it. Don't ask her, are you sure? Those are 2 questions you want to absolutely stay away from because it's going to come off as judgmental. Even if your intentions are the purest that you've ever said words, it's just going to come off wrong. And so, we train on this. And it's interesting because when the first original Safe Haven law was passed, there was no money for training. So we incorporated it into the baby box program. So every location that gets a box gets trained, and everybody in that county can take the training for free.
And you also offer resources to the moms in the baby box, right? There's like an orange bag that has information in it that they can take with them, right?
Yeah, there's a lot of information in there that we want her to take. Now, she doesn't have to take it, obviously, if she doesn't want to, but about 75% of the moms do take it. And there's trafficking information in there. There's the Safe Haven registry in there if she wants to send in information later on, after she's kind of cleared her head a little bit. She can do that. There's also medical information. I mean, these women are giving birth in bathrooms and cars and homeless camps. And, we all know that infection and hemorrhaging and depression are going to set in if she's not careful. And so there's information on that in the bag. There's also an informational packet on the law. And then there's a letter from us because this parent is not going to get thanked. She's going to get criticized, if anything, if anyone finds out. And so we thank her for keeping her child safe and for basically saying, I want what's best for my child and it's not me, and being that hero of a mom. So the orange bag is very important, and we hope that every parent takes it.
Now we're going to take a moment to hear a word from our sponsors.
Do you remember back in the day when there was a really bad smell at work and everyone would have to use like the communal tub of Vicks VapoRub and put your finger in that same tub and spread it all under your nose? How gross that was?
Yeah, been there, done that. That's disgusting. That's why I like Stink Bomb Odor Blocker. It is way more sanitary. It's convenient, easy to use. It looks like a lip balm, but it's not a lip balm. It's just something you dab right under your nose, and it smells amazing. There's an optional retractable badge holder that you can get to hold it and just kind of clip it right there on your lanyard. I love this stuff.
Yeah, it comes in numerous scents, and they gave us a discount code for y'all, Uncorked 15 for 15% off. You can go to stinkbombodorblocker.com or the link in the description of this podcast. Jessica, do you ever have non-nurses that follow you, other healthcare workers, reaching out asking where they should go work, where they can find a job?
I do often. And the answer is simple. The Vivian Health app is amazing because it is a job marketplace for all allied health members. So anybody, CNAs, LPNs, occupational therapists, RNs, like there are so many job options. So I always refer everybody to Vivian Health.
Yeah, and it's not just full-time jobs. It's part-time, per diem, travel contracts, local contracts, everything. It's just like you said, a job marketplace, and they can browse all the jobs there.
Yeah, so if you want to land your dream job, download the Vivian Health app today. The link is also in the description of this podcast.
Hey, Jessica, have you ever Google searched your name or your name and address?
Oh, I have many times, and it's actually scary. I've seen things pop up like locate Nurse Jessica Sites, Nurse Jessica Sites address, find Nurse Jessica Sites phone number. It's scary.
Oh, yeah, it really is. That's why I've been a long-term customer of Delete Me. They actually go online and help to remove all of your personal information from hundreds of online data broker websites. So they will remove your name, your address, your phone number, your social security number, your place of employment, your family members' names. You can even request that specific things be removed.
And what I love is that Delete Me, as one of our sponsors, has offered 20% off to everybody. All you have to do is go to joindeleteme.com/uncorked. So you can get your 20% off. And the link is also in the description of this podcast. Okay, we're back with Monica. I'm going to dive into the next question here. So obviously, a lot of the babies that are surrendered are brand new babies, and you were saying, they may still have the cord or the placenta. What type of additional training do you have to do for providers or people, that work at the firehouse, or are they already trained in this kind of stuff, like to be able to know what to do in that circumstance to get and transport the baby to the hospital?
Well, the great thing is we put babies where there's medical staff,
Yeah.
stations and hospitals. And so paramedics are your highest trained in the field, and they are well equipped to deal with a newborn infant. Even if a baby is in distress, they're able to take care of that infant. We also have medical bags that we dispatch with the boxes if they need them, which has all neo stethoscope,
Yeah.
pulse ox for an infant, those kind of things to make sure that they have everything on hand at the box. In case their truck is out that has that information, there's actually one that just stays with the baby box. But they're already trained. We don't have to do any of that. And that's the good thing.
Right.
Because this is what they do. This is just adding, another tool to their toolbox to save the life of a child.
Yeah, I mean, it's not like you're installing it in the McDonald's or something. Where,
no. Although it would probably get used at McDonald's.
Right? Seriously. I wonder how many women, and I don't think this question's on here, but just like, I feel like more advertisement might not be the right word, but more like information that there's boxes versus just a safe haven law. Like, I wonder if a lot of moms just don't know that part of it yet, that there are places that you can not have to go in and see a person and, hand off the baby. Or leave it, like you hear, at the doorstep of a fire station or something. But, I mean, do you guys feel that way? Like, do you feel like maybe more people need to talk about it? I mean, so that more moms are aware?
Yes. Yeah. There's no education around the safe haven law and no awareness. There was no money put with the law when it first passed in all 50 states. And so basically they passed a law and they held you a piece of paper at the firehouse, which I'm a firefighter, and they handed you a piece of paper and said, okay, you're taking babies now. And we're like, what? Like, What are you talking about? Like, no, we're not.
Wow.
But there was some training that came along with it. They basically just gave you what the legislator, passed. And so now, we're putting, like, this year alone, just in the state of Indiana, we're putting $150,000 worth of billboards up through the year.
That's
that's an education. Yeah. Social media, huge on social media. We have a lot of parents. I talked to one, not yesterday, but the day before, a parent that utilized our box. And this was a couple weeks that she, passed when she had used it. And she was thanking us. And I love talking to these moms because it feels like I'm giving back a little bit more to be able to walk alongside them. And I said, well, where did you learn of this? And she learned it on TikTok.
Yeah, TikTok is huge for that.
It's an amazing platform for learning things and spreading information. Yeah, it truly is.
Yeah, so that's where she heard it. So
I love that.
That's great.
I know that the boxes are in secure locations, hospitals and fire stations, but have you ever had a box vandalized? Because anyone can walk up and open it, and then I assume it would set off the alarm, but it would be a false alarm, if there's no baby in there. Has that ever happened?
Well, I mean, we get false alarms where kids walk up to it and are like, what is this? And they open the door, and yeah, it's going to set that alarm off. That 3 fail safes that we have. One of them is if the door opens but no baby's placed inside, it's still going to alarm personnel. And, you know, when I first installed the very first baby box in my fire station in Woodburn, Indiana, we're next to a park. That was the stupidest thing I could have flippin' done. Like, well, this was the first in America, you know, so this had never been done before. And now I'm putting it in a fire station next to a park. You can imagine the kids that were coming over there and opening the stinking box.
Yeah.
Finally, like one night, like we had been down there 3 times, and I was like, listen here, you little pricks. I don't know, can I say pricks on here?
Yes, go for it.
I was like, listen here, you little pricks. Which one of you guys keep opening this box? And they're all pointing to the little boy over there. And I said, okay, let's go. Let's go open it and play with it. This is the last time.
Get it out of your system. Get it out.
Touch it. I don't care what you got to do, but don't open that door again. And that actually brought the false alarms down, you know, to where they weren't opening it as much. Now, I mean, we've been in the building for 7 years now. We maybe get a false alarm twice a year. So it's not very often where these kids come over and just open it up. Some of them are just, you know, they know what it's for, but they're just being, you know, jerks. And opening it and watch the firefighters run, or maybe it's some girl that wants a date. I don't know, but
they want to see the hot firefighters.
Not every fire station has some hot firefighters. There are some old guys at some old places that are over.
I don't know. They seem to have a disproportionate amount of hot firefighters everywhere I look, but.
That's actually just the ones you see, Erica. That's just
I know.
Chicago Fire is not real.
All right, let's get into this week's problem of the week before we take or give Monica the next question, rather.
Problem of the week.
So I was written in by one of our listeners, and basically her problem was that she's constantly having to stay after her shift to finish charting, because obviously, as every nurse is stretched to their capacity, and she can't get in all the charting that she needs to do. So after she's done with the shift and she's given a report, she's having to go back and chart, but she keeps getting interrupted at the desk, like as if she's still there on the unit working. A doctor will pull her and ask her something. You know, there's a whole list of stuff. Nobody's at the desk, and then the call light's going off. What can she do, or how do they solve this? Is it solvable?
Yeah, I've had that happen to me so many times. Do you know there are some hospitals, none that I've ever worked in, I take that back, one, where they have designated rooms behind a closed door just for nurses to go chart with all the computers. So patients cannot walk up to you at the desk. You're in a room charting. And really, it's so practical. And
every
it's a safety thing,
that.
So we're not interrupted all the time. Yeah, every hospital needs that. Just like you need your own med room behind closed doors, you need a charting room like right back behind the nurses station somewhere close behind closed doors. I don't know that there is an answer. If you don't have that, you can certainly talk to your manager and request it, but a lot of time there's just limited space in hospitals.
My hospital used to have, in our break room, they had 2 computers set up, but I still found that even in there, people want to be chatty with you. You know what I mean? Like other nurses on the next shift come in and they ask you questions, and especially I have ADHD, and then you still are like, what's happening? Like, so I think ideally if the hospital could designate, that would be amazing.
Or if you have enough of the cows or wows, the workhouse, whatever, on wheels, what is it called? Workspace on wheels.
Yeah, or
computer
workstation
on wheels,
whatever. Or
yes,
computer on wheels, whatever.
Yeah, if you have one of those extra, which no one ever does, you could take that into, like, I had a locker room at the hospital. I could go in there and try and get away from people.
Or an empty patient room, maybe, if there's a bunch of...
Yeah, if you had enough, but usually there's not even enough for everyone.
Yeah, so
I don't know.
Otherwise, I'd say try to find somewhere to hide. That's your that's your best bet, girl. Actually, what I would say is maybe they could fix the staffing ratios so that you had time to actually do your computer charting while you were there, and then we wouldn't have this problem in the first place.
But that's way too practical.
Exactly. So I hope that answered your question. Send us in your problems of the week to nursesuncorked@nursesuncorked.com. I want to hear from Monica. How is that feeling when you get to call somebody on your team to tell them? Because I love those videos that another baby was, surrendered, and you get to make these calls. And half the time I'm laughing because people aren't answering their phone, and you're so excited to tell your team that you've got another baby and you'll finally get somebody on the phone. But how amazing is that feeling?
It's amazing. People criticize me for being excited when we get a baby in one of our boxes, but that's a baby we didn't find dead, and we should be.
Right.
And
You
so
I
should
agree.
be.
I have to start something because I'll usually be like, hey, what's going on, and they're like, oh, nothing, and they'll just give me their life story or whatever. So I've got to kind of change it up a little bit because now they're kind of figuring out that I'm calling and asking what they're doing, and they're knowing, okay, where was the baby at? And it's interesting too. So I call my mom my adoptive mom, I call her every time we get a baby. Every time we get a baby, I call her. And she's always like, did we get another baby? And I'm like, yes, we did. And she's like, I'm so proud of you. And she cries. And it's like, and there's some things that she says, she's more like me, raw and real, and just kind of opens her mouth and doesn't realize what she just said. But I kept one in a couple of weeks ago where she said one of our locations had gotten 3 babies. And her response was, do they hand out condoms at this fire station?
Did they put that in the bag? Is that in the bag?
Mom, no, what are you talking about? So, she just kind of doesn't think before she speaks sometimes. I think that's where I get it from.
That's okay.
But it's pretty incredible, though, to call. And I call all of them. It's like I'm going, except the guys. The guys, they don't answer their phone when I call anymore because they think they're in trouble. So I just call the female.
Like, what did I do?
Do you have a favorite memory or case that sticks out?
Of a surrender?
Yeah.
Probably there was one, probably 5 years ago now, where a parent had surrendered and then contacted us 21 days later. And it was one of those cases where she didn't want her baby back. She just needed a little bit of help. And so we put her in our counseling program. And a lot of times they want to talk to me. I'm not a counselor. I don't counsel them, but my face is out there. They feel like they connect with me on social media.
Yeah.
So I give my cell phone numbers out to these women, and she contacted me and we started talking regularly, mostly texting. And then I had dinner with her. And I asked the question, I said, why did you, because she was talking about sitting in the parking lot, looking at the box and seeing the guys walking around inside the building. And I said, well, why didn't you just walk in and hand this, your baby to one of the workers? And what she said, actually, I've never forgotten. And it actually made me think of what I used to do as a firefighter. And she said, I didn't want them talking me out of a decision that took me so long to make.
Yeah.
And that's exactly what firefighters do. We try to fix things. We try to fix things. And now she's a volunteer for our organization. She's a good friend of mine now. And you meeting her on the street, you would never know that she found herself in a situation where she felt the box was the best option for her. But she's amazing, absolutely amazing, just a stunning individual. She's got a professional career, and she's amazing. She's one of the strongest women I've ever met.
That is amazing.
I don't know if you feel uncomfortable answering this, that's fine, but you don't have to. But how did you find out the circumstances of how you were abandoned? Was that a story you were always told, or how did you find that out growing up?
Actually, what my adoptive parents were told when they adopted me was that my birth parents were young and loving and couldn't care for me. So they placed me for adoption, which was very common back in the day for them to lie to protect the child. And so I actually met my biological mother when I was 37, and that became the best and the worst day of my life. I actually found her by accident.
Really?
And,
how?
Yes. That's a whole nother story, but I went looking for her. And it was a journey. I was told, that she loved me so much, she placed me for adoption. So I had no idea of what was actually the reality. And so I thought, well, she's going to want to see me. She's going to want to meet me. My biological father, he's going to want to meet me. I want to know who they are, part of their life. And, I think what every adoptee kind of feels like. And then when I met her, I was actually sitting on her couch in her living room with my husband by my side. And I asked her, the question of the elephant in the room, who's my biological father? I want to meet him. And she got up and she walked into her bedroom and she came back with this blue folder that was tattered and it was torn. And And she pulled out a police report from August of 1972. And as she's telling me this story, and my husband, we talk about this a lot, when she was telling me this story, it was not registering that she was not only telling me her story, but she was also telling me mine. Because I just didn't want this to be my life. I was like, oh, I'm so sorry for you. That's just horrible, thinking, I was more worried about her. And then it's like, oh, no, wait a minute. That's when I was born, And so, but getting to know her though, she's passed away now, but getting to know her, I think became the launching pad for Safe Haven Baby Boxes because it gave me the empathy that I needed to work with these women. I didn't have that before. I would have criticized, and I'm just being honest, I probably would have criticized some of these situations that we've helped today. But after meeting her and knowing her circumstances and the pain and the crisis that she was in, it really turned the tide for me to work with women like this, to love them instead of judge them, and help them, give them a hand up instead of pushing them down. And I'm thankful that I met her. I am. But I was shocked. I was literally confused and shocked. And I actually, after I left there that day, I did not believe her. I tried to prove her story wrong. And I drugged my husband around the state of Ohio, to the police department, to the courthouse, to the health department, to the hospital. I mean, I wanted somebody to tell me that this was not my life. And everybody,
especially since you had heard such a different circumstance, like all your life, thinking it was one way. And then to hear that it was totally different, your mind probably plays tricks and it's like, well, is she covering for him for some reason?
Yeah. And I actually, I don't talk about this very often, but we're friends here, so I'll tell you.
That's right.
But I actually showed up at his house. I was so determined to prove this story wrong that I showed up at his house. And
was he there?
He was not, but his wife was there.
Oh.
And her first words
Did she know about it beforehand?
Yes. I walked up with my husband. We actually videotaped this, and I've never shown it, but it's on video. And maybe one day I'll show it. I don't know, but I walked up, and the first thing she said was, "I know who you are, and you're not welcome here." And
how could she know that?
There was a lot that she probably knew, because they had been married for 40 years. I mean, they had been together for a long time, and so yeah. And then I get, after I left that day, 2 weeks later, I got slapped with a restraining order to stay away from him.
Oh my God.
That's
so kidding?
That's beyond, I mean, rude isn't even a word for it. It's like, you were the product of a horrible thing that he did.
A crime.
Yes. Yeah.
Did he go to prison?
He did not go to prison. Actually, he was arrested and he was charged, and then it became a he said, she said. Even though she was brutally beat. I mean, the hospital records were there, but back in the day, they just did not believe women when they would come forward like this, and so the charges were eventually dropped.
Wow, I think I read something or saw a prior interview with you where you said that it was her mother, which would be your biological grandmother, that pushed for her to have an abortion, which was illegal at the time. Are you comfortable telling us a little bit about that?
Yeah, so it was in October of 1972, which abortion was illegal. Even in the cases of rape and incest, there were no exceptions. And so her mother actually paid for her to go to a back alley abortion facility in Columbus, Ohio.
Gosh.
And while she was standing in this room with this man that, was going to snuff her child's life out of her, she changed her mind. And I asked her one time why she changed her mind. And she said that there was blood on the floor and blood on the gurney, and she just felt like she was doing something wrong. And I sit back and I think, she was doing something wrong. She was breaking the law. And that law literally saved my life. But her mother was very angry with her. That's why she was hidden after she gave, after she found out she was pregnant and she didn't go through with the abortion. Her mother hid her. She didn't leave the house. Took her out of high school. And then they abandoned me, 2 hours after I was born. But it's one of those cases where you look back and the timing was so different in the 70s. anybody that was unwed and pregnant the entire family was looked at in a negative way. And so she was trying to protect her. Only years later did I find out how devastating her life really was, because in October of 1972, not only was she at this abortion facility, but her dad died of a massive heart attack at the end of October. So she was dealing with so much, my birth mom.
Wow.
And
I can't even imagine. Like,
And she was only 17.
what
And
a
she was only-
load to have on you. Like, I mean,
I-
but
I-
it almost makes me think that you had her come back into your life for a reason. Like, had you not met her and decided, to meet her and talk to her, then you may not have ever heard this, that information as to how bad her life was. So like you were saying, it gave you that empathy to push and understand, what other moms could be going through. It could be something horrific and nobody has any idea,
Right. Yeah.
Yeah.
You're absolutely right.
Did your birth mom ever get to know about this, that you created the Safe Haven baby box prior to her passing?
No, she did not. She knew I was
That's a
speaking
shame.
about the story. I asked her if it was okay if I told her, because this is her story. This isn't mine. I'm a part of that, obviously, but this truly was her story. And I asked her if she was okay with me talking about this. And she just didn't want me to give her last name. And so I've never released her last name. But she was amazing. She was absolutely amazing. The first thing she said when I called and found her was, "I've been waiting for your call." And so every year on my birthday, she baked a cake. And no one else knew what that was.
God.
But that was her way of honoring me. And another thing that's interesting is in her mind, she named me Michelle. And my youngest daughter's middle name is Michelle.
Oh,
wow.
Yeah. So it's just a lot of similarities over the years, and getting to know her was literally the turning point in my life where I knew that I had to stand up and do something for others that she didn't have back in that day.
Have you written a book? You need to write a book. Like, seriously.
I know, right?
Like,
You did?
I did.
Oh,
Yes,
well, tell
it's
us the name of it so that we can check it out and tell our listeners about it.
It's called Blessed to Have Been Abandoned, the story of the baby box lady. And it's on
see,
Amazon.
You're smart, because now I want to read
All right, we're going to link that in our description for the listeners.
Blessed to
That's
have
amazing.
been abandoned. Yes.
Jessica's
Sorry, Eric.
writing it down.
I am. As if I can't look it up later, but still. Eric, I cut you off. What were you about to ask her? Because I just thought about that, about a book.
Did your mom, your birth mom, go on to have a good life? Did she get married? Did she have other kids?
She got married. She had to have a hysterectomy at 23, so she had no more children. She had a little boy that passed away. I think she was 21 when she had him, but he did not live past birth. But she married a man that had 4 boys, and those boys became 4 boys. And so she was married for a long time, I think 30 some years, to Perry. And she did. She kind of stayed to herself. Wasn't really a person that got out a whole lot. She had a huge garden, an acre garden, that she was called a master gardener. But she struggled. She struggled the first 10 years after this, and then finally got her life together. So,
what can people do to help get more boxes around the country or in states that aren't doing it? Or what can we do? How can people help?
Contact us. If you want to try and get the law changed in your state, if it does not allow for baby boxes, or there's just a gray area and you want to make sure that women are protected, contact us. That's the best way to start the process. Actually, on our website also it's a roadmap. It's an actual road. It's like, this is your first step, this is your second step, this is your third step, and it goes so that you make sure that you hit all of these steps. But it will get you from start to finish to get a box in the community. And then if you just want to, you can donate to us. We're a 501c3, so all of our financials are public. If you want to sponsor a med bag, that we drop off with every baby box at locations, or a bassinet, that's on our website also. If you're ever in Woodburn, Indiana, it's a small community. Stop in. We'll take you for a tour of where these boxes are built. And you get to see all of the pictures of the babies on our wall, of the babies that
I love it. And your website is shbb.org for Safe Haven Baby Box, right? And
You
do you
got
also
it.
have an Amazon wish list? I think I saw that.
You do, yeah. So, like paper and stuff, if somebody doesn't want to give an actual monetary donation, they can actually just turn around and buy paper for us. I mean, that's just as important because we have to do the day-to-day operations, and that costs
Sure.
money. People help us out on the Amazon wish list. That's even better. We also have tumblers, and we make the tumblers, and I know I have some dead flowers in this tumbler, but I'm just showing you the tumbler.
That's cute.
But we
I love
make
it.
these. And so people buy us the tumblers and we take them back in our shop and we actually put the logos and we make them different colors and stuff. So we do tumblers also. So it's just a lot that we do, but there's a lot of ways that you can support us.
Sorry, the National Crisis Hotline for Safe Haven Baby Boxes. Want to get that information out there. It's 1-866-99-BABY-1. Right?
You got it.
And we're going to put all this in the description.
Yep, that's the workhorse of our organization.
Can you tell us before we kind of wrap things up? I want to hear the feel-good story about, I think it was a first responder or a firefighter maybe that may have adopted one of the babies. Can you talk about that a little bit? Because I did happen to sneak peek that video and I like this story.
That is baby Zoe. And then we've actually had another firefighter that is now in the process of adopting one of the babies that came through the baby bank. But baby Zoe was surrendered in January of last year. So maybe 18 months ago. And it was in the Ocala baby box there in Florida.
Okay.
And he was woken up in the middle of the night and he was the first one down there to take baby Zoe from the baby box. And he said the moment he locked eyes with her, he knew that she needed to be his daughter.
Oh, that's so sad.
That is one of those stories where it just literally makes your heart smile. But they went through and it wasn't that they just handed the baby to. He had been with an adoption agency down in Florida. They had been working for 10 years.
Oh my gosh!
And so it was just kind of like luck that he was the next on the list. So he adopted, him and his wife adopted baby Zoe. It's the only child that they have. She's beautiful. She's healthy. And she's going to grow up knowing, where her life started at that firehouse because that's where her dad works. So it's just a beautiful, beautiful story.
Oh, I got goosebumps just listening to it.
I know you go around doing some public speaking and you go to schools sometimes, but what's next for you and Safe Haven Baby Box? What are your goals? What's coming up next?
Well, I don't ever make goals. I always said where Christ leads me is where I'm going to go. And I hope in 10 years I'm not doing this. I hope we've finished the race. I hope we've finished what he has put me on this earth to do and eliminate infant abandonment. That's what I hope. But wherever he takes me is where I'm going to go. And every day is a new day here. Every day I don't know where I'm going. I'm just, kind of in true firefighter fashion, flying by the seat of my pants.
That's all you can do.
It will be a good day though, when these boxes aren't needed. So I do hope one day we eliminate infant abandonment. And hopefully these babies, will be saved. Whether it be in a traditional adoption plan or a parenting plan by the parents who love them.
Where can people find you on social media?
Well, TikTok is our biggest following. I know some people don't like TikTok, but I don't care.
We are TikTok people here.
But TikTok is that's where we're raw and real. So if you really want to follow Monica Kelsey and I love Jesus, but I cuss a little bit on there. So just prepare yourself. You're going to follow me on TikTok.
That's okay.
Facebook, Instagram. We're on all of social media platforms trying to reach these parents to let them know that these boxes are available. Safe Haven Law is available.
What's the name of your account? Is it Safe Haven Baby Box?
You got it. Yeah.
Okay.
Or you can type in Monica Kelsey. It'll come up also. I did just this morning posted another video, and this was of a fire chief calling me. We got it on video. It was in the middle of the night. Of him calling and letting me know that they just had their second baby in their box. So I just posted that this morning.
Oh, I'll have to go watch it.
That's amazing.
I love these stories. Erica, do you have an enema this week that you'd like to give away, or are we doing another golden stethoscope?
No, I have an enema award this week. Yep, we're back to enema. You may have heard me recently talk about allegedly Tenova healthcare in Clarksville, Tennessee, where they were tripling and quadrupling their ICU nurses allegedly. They are certainly not the only ones. This has been going on for a long time. I've heard about this countless times. That one in particular resonated with me because they were threatening termination if they didn't accept it. So,
Oh my gosh.
go see my video if you want to know how to fight that, because you absolutely do have rights, and that's not legal in several different ways. But this week's Enema Award goes allegedly to Tenova Healthcare and any other ICU that is tripling or quadrupling patients. They're truly ICU status. It should only be 2 patients to 1 nurse, no more.
And management needs an enema because clearly they're full of shit.
That's right.
Yeah. Enjoy Tenova and all the other places that are doing this to your nurses. Enjoy. I hope you get stomach cramps. Thank you, Monica, for coming on. I really appreciate it. You have to ask Erica. I've been talking about getting her on for a while now.
Yeah, she has for like a few months. She's brought it up several times, and finally we got around to it. So thank you for coming.
Yes,
really appreciate it.
Thank you. We really appreciate it, and hopefully this will get the word out there more. And people follow on social media, share videos. Like, the more moms that can hear about it, the better. So until next time on the next Nurses Uncorked.